we may have to record it and put it on YouTube. For some reason, it's not letting me go live. Anyway, so we're going to get started. Thank you for everyone who's here. My name is Dr. Famuyiwa with Montgomery Fertility Center. I appreciate you being here tonight. And tonight we have the pleasure of having Rada Pradetskaya, who is a licensed acupuncturist in the state of Maryland. Now, Rada has completed a master's in acupuncture medicine, and she's completed another master's in herbal pharmacology with a specialty in fertility nutrition. So tonight she's going to be here today to talk about acupuncture and fertility. And I want this to be interactive. I want people to ask questions, send us questions in the chat. So without further ado, I'm going to let Miss Rada Pradetskaya talk. She is an acupuncturist in Columbia, Maryland. Thank you. Rada,
good evening, everybody. I'm Rada Pradetskaya. I'm a licensed acupuncturist. I graduated with my first master's in 2005 from the school. It used to be private school, and now it's called Maryland University of Integrative Medicine. My very, very first degree before that was dental hygiene. So I came from a career in Western medicine, which I still do, combining the two, and then became an acupuncturist, and then later on went for another degree to do specifically to fertility, herbal medicine, Chinese herbs, and interaction with drugs, specifically with fertility medicines, to know what's safe to do, what's not safe to do, because my biggest concern is my patient's safety, how we can do it together with fertility doctors, how we can do it safe. So I just want to little bit talk about acupuncture first. Acupuncture is a very old, ancient medicine and art, and it dates back to 4,000 years back in China. Very interestingly, how it all started is that Chinese monks in the monastery would do martial arts and would experiment with different parts of the body, stimulating them, what at that point used to be like little darts made of stone. And they realized that if they had a headache, by stimulating certain point in the body would help that headache. And then years and years of body and actually meditating, which is kind of may sound strange to some people, but that's how they got some of the information. They actually had a map of the body, and what they realized was quite fascinating, that we have 12 main channels. I'm going to show you a little human that has, on its body, it has many different points that correspond to different organs. So in our body, in our human body, we have 365 points that correspond to a calendar. So we're part of nature. We have 12 channels, which correspond to different organs. And then 2 more channels, one of which is called conception vessel, which is specifically dedicated to conception and fertility. Another one on the spine called governing vessel, that has to do with spine and also connects to the conception vessel. So everything in the body is interconnected. By being an acupuncturist, when a patient comes to me, the first appointment, what we do is we spend 2 hours. We talk about everything. We talk about your medical history. We talk about your health. I'm not talking just fertility. I'm talking about your diet. I'm talking about digestion. I'm talking about your sleep and stress. I'm talking about your sex life. I'm talking about different stressors in your life. Many, many different issues will contribute to your ability to become pregnant and carry the baby. And then acupuncture, fertility acupuncture have been quite studied. There were many studies done, but mostly important were, out of 100 studies, were 20 studies, one of which, called German study, was the biggest study, and it had 862 participants in it. They were divided in 2 groups. One group received IVF only, and one group received IVF combination with fertility acupuncture. Now, this was done in a period of 3 months, because nothing is a miracle. You need to prepare for fertility. It's not just like, magic happens. So what they realized by doing that study and following those people, that when they did IVF only, they had 23% success. When they added acupuncture, the success rate went to 42%, which was quite significant. And the reason why it's happening, again, there are many benefits to acupuncture, but I'm going to call few main ones so that you can understand. One is acupuncture helps to release and reduce stress by producing endorphins in the body. And as everybody knows, when you're trying to become fertile or preparing for fertility, you worry about so many things. Stressors are everywhere. How it's going to happen? Why am I not getting pregnant? I've been married for a couple of years. We've been trying. You know, stressors of, do we have scheduled sex? How do I monitor my period? All of those things are not helping you to relax and become pregnant. So one of the things is that acupuncture will help you to reduce stress. Now, one of the second benefits is, if I don't know if you guys can see, if you look at this middle of our body, there's this conception vessel right there. So when you're stimulating, and I'm going to show you needles later, when you're stimulating conception vessel, you're helping to regulate blood flow that goes to the uterus and ovaries. And then that's one of the biggest effects to acupuncture. It regulates menstruation in women. It helps to regulate and balance hormones. Not specifically like by, okay, we're looking at estrogen or we're looking at progesterone. It actually helps to regulate and bring body into balance so that the body can go into homeostasis and regulate the hormones. And then in man, it helps to produce healthy sperm. Now, another thing that you could achieve with acupuncture, now talking about eggs. Acupuncture is not going to help you to produce more eggs because you have a certain amount of eggs that's given to you by life. However, acupuncture will help you to produce quality of eggs. And that can be achieved with acupuncture, but together with diet, nutritional changes, and stress reduction. So again, when I'm working with each patient, I'm working with everything. Diet is huge. I'm going to teach you in the future how to eat certain things and not eat certain things to produce wonderful earth so that you can plant your seed and it will grow. Because when many people come to me, they basically are so tired. They tried IVF or they try IUI. It didn't work out and they feel like their earth, so to speak, is dried up. How can you plant a seed when your earth is dried up? So you need time to replenish your earth. And what I can help you do is to do exactly that with acupuncture and nutrition.
Yes.
Couple more things that I'm going to talk about acupuncture benefits. One of which, it helps you to prepare for a transfer. So it assists in implantation. And once you're pregnant, I treat people through the whole pregnancy. It reduces chances of miscarriage. Now, sometimes it does happen. People do have miscarriage. There's so many different variants going into it. And nobody can 100% guarantee. We're not like, we don't do miracles, but we assist your body to prepare your body to the maximum state where it will be relaxed.
Radha, your audio is cutting out, but I'm going to reemphasize what Radha just says. Multiple benefits for acupuncture, right?
Different things, but those are like the basic introduction to what I do.
Excellent. So let's do a brief recap.
Okay.
Acupuncture will reduce stress.
Yes.
Reducing stress helps your fertility.
Absolutely.
Acupuncture releases endorphins, right? Which are the natural body's painkillers.
Yeah.
Which is good. And acupuncture can be individualized, right?
Absolutely. It is actually individualized. I don't do the same points to each patient.
Exactly.
There are specific points that help fertility, but I always combine. Every time the patient comes, I always ask them, what is going on with you? Tell me about your life. Tell me about your maybe some marital issues. Tell me about your exercise. Tell me about your diet. And I will do pulses. And pulse in acupuncture has 28 qualities and quantities. So I'm looking at how little change is happening in your body. Every time you come to me, you're a different person. Life has lived you. So my job is to create specific treatments to you today that will help you, be in balance. It's never the same treatment. Now, they could be the same points somewhat, but I always tailor to what you need right now.
And I guess
Absolutely.
that's the key focus of acupuncture. Acupuncture is not like Western medicine where you come up with a protocol that you apply to a bunch of people. Acupuncture is more individualized.
Actually, yes and no. So there's specific protocols for different issues. So let's just say by doing Chinese medicine diagnosis, you recognize that the person, for example, I'm going to use a term that I'm going to explain, has coldness in their uterus, for example. That just means in our language that their periods are irregular. They don't get regular periods. So then we're going to apply specific points that regulates that issue. So we're looking at a certain diagnosis, just like in Western medicine, and we're applying certain point combinations to help that diagnosis. But together with that, you're constantly looking at human that is evolving and living their life. So we're looking at them not as a machine, we're looking at them as a live human being, and what do they need? Let's just say that you're cooking rice. The rice pot has to be moving. When we don't experience ease in life, the rice pot can get stuck. And so you can have your rice burned. So our job is to help the balance. So the rice pot, and the lid is moving. And that's kind of the visual that I always give people, is that I help you to create movement in life, to create balance in life, so that everything is your energy is moving correctly. And then your body can regulate itself, basically.
Excellent. Thank you very much for those. And then in the past, people would do acupuncture usually around transfer. But now we're telling them you don't have to wait for that. You can get started and have a regimen even before, sort of getting your body ready.
It goes back to the theory of fertile earth. By the time they're doing transfer, they've been so tired and stressed. So yes, it could help them to assist with transfer, but it's not very beneficial.
Right.
When they come to you, that's when they start with me. Yes. Ideally, it takes 3 months to prepare their body before the transfer. However, where they're starting is where they're starting. I'm going to assist you in that.
Yes.
But basically, our job, my job, and your job is to create a fertile earth.
Right.
So that whether it's with medicine, with acupuncture, with certain herbs or supplements, that when you're doing the transfer, everything is prepared. And then right before the transfer, they come more often to assist them with that transfer. But it's not a miracle solution. We don't have a magic wand to all of a sudden somebody who's out of balance, when they're doing transfer, to boom, do acupuncture, and it's going to help it all. That's actually not very true. So they have to be prepared,
and that goes along with what we tell our patients. If you're planning on using your eggs, you probably want to start getting your body ready a month, 2 months, 3 months ahead of time, because the eggs are located inside your body. Healthy body, healthy eggs is what I usually tell patients. And that's part of that.
Absolutely.
Yeah.
Yeah.
And one of the things.
Example,
yes, go ahead.
No, for example, real quick. So I use a nutritional company that goes Standard Process. The difference, Standard Process is not sold in the store. It's through practitioner only. You have to be trained. Now, what Standard Process is basically 100% organic food made as medicine. It's not a medicine, it's food. So we're feeding their body parts. There is specific, like this one called Ovex feed, for example. So those are a combination of foods that supports the working of your ovaries. And again, you start that 3 months before they have IVF or 2 months before they have IVF. And then when they get to IVF and they start certain medicine, you stop that, but you continue with something. I'm just giving an example that calls utrophin, which is uterus support, because uterus support, they're going to need to have healthy implantation in the pregnancy. So my job is to know which supplement to introduce and when, and which supplements to take away and when, and then talk to them about healthy eating. Like,
Yes.
for example, a lot of people are doing fast food or they're eating cereal in the morning. When you're trying to get pregnant, it's not a good idea.
Yes.
You must have had breakfast. You
Yes.
must like allow yourself more time in the morning to make that healthy, warm breakfast. You should have more stews. You should have more soups. You know, things that are warming, that are beneficial. You shouldn't be having lots of sushi and salads because it's not going to help you keep healthy fertility. You know, like, for example, you need good oils. You know, people are like trying to go oil-free, fat-free. I'm not talking about overdosing on oils, but you need good butter, you know, for healthy fertility.
Yes.
So there's all those things will go into the picture working with each patient.
Yes. That's very good. That's very good. And I think one of the things I like about you is also you include the nutrition.
Oh,
You
absolutely.
talk about nutrition. You are very heavy on nutrition for our patients to see which nutrition is going to help us to give us the best outcome for
Right.
both eggs and sperm.
Like, for example, I'm a big proponent of vitamin D. Like, everybody has to be tested for D, and everybody should be taking it depending on their levels. But vitamin D is a healthy regulator and helps the fertility and helps your hormones. Another one is like people are talking about Chinese mushrooms. We're not talking about mushrooms grown in China. We don't want that. We want organically grown mushrooms. For example, there's specific ones that could help you with your fertility, and there's specific ones that you can take into the pregnancy. It just depends on what you're taking. You know, so that's why my second degree, that when I did the herbal pharmacology, I had to learn which herbs you could do and which herbs you should not. And a lot of people are going to go into Google and say, oh, this will help me. I'm going to go and buy this in the pharmacy. Not a good idea. You should consult with both doctors. I usually work with my fertility doctor, and we talk about, you know, certain things are safe and certain things you could take for 2 months and stop, and certain things are not safe. So it depends, you know, what you're doing. If you're going to Chinatown and buy some Chinese herbs from China, might not be a good idea because you don't know what's in them. But if you're buying from a practitioner trained here, who are buying from a company grown in the United States with a different level of safety, that could be safe. You know, so it just depends on the knowledge of the practitioner.
Yes, yes. So does anyone have any questions? If you have any questions, put it in the chat.
Yeah, let me see if I can, I hope I don't get disconnected. There's some questions. Hold on, let me see if I can open that.
If you have any questions, what you can...
Yeah, does acupuncture help with POI? Yes, because again, this is just a label.
Yes.
And when you're coming to me, I'm looking at what does it mean for you? How does it manifest? And then I'm treating accordingly to that. The second question, can continue with acupuncture during pregnancy? Absolutely. Except that there's certain points that are contraindicated during pregnancy, so we don't do that. And they're specific by trimester. So I know which points I cannot do, and I know which points I can. And I treat people from the whole pregnancy until delivery. And then after they deliver, they come back because they're exhausted from feeding the baby, you know, and then they want to have a second baby. So it's a continuous relationship, basically.
And then somebody asked if acupuncture can help with thyroid issues, and the answer is yes, actually. Yes.
Yes, and of course there are points around thyroid, but thyroid condition is always related to what's going on with the digestion, actually. So you always, from acupuncture point of view, you have to look at nutrition. There are a lot of people walking around that have gluten sensitivity. You might not be completely celiac, but you're going to have gluten sensitivity. The minute you're going to reduce or remove gluten from your diet, your thyroid will regulate. And it depends on the
exactly. Somebody asked a question.
But
is acupuncture recommended prior to elective egg freezing?
It wouldn't hurt, because at this point you're going to prepare your body for egg retrieval. So I would say a couple months to create better quality of eggs. Yes. So you wouldn't. Yes. Usually I see them when they're starting IVF process, but again, it wouldn't hurt. No, absolutely.
Yes. So for egg freezing, you also want to get your vitamins in place, start eating right. So that's where Miss Rada comes in place. You want to make sure you're eating all the nice, healthy nutrients that will help your eggs, right? So the better you take care of your yourself, the better you're going to be. And I'll just throw out real quick, because most people don't know, medical marijuana is not good for the eggs.
No,
so
not good.
Yes, it's not good for the eggs. Please spread the word. I know everybody's on it. Please, medical marijuana is not good for your egg quality. I hope
for anything. For anything. So I work with a doctor in Florida who I love, Dr. Rosa, and he would not take a patient that is doing marijuana. The minute he hears that, he would say, okay, you need to stop or you're not coming back. Because what happens is they have tremendous amount of miscarriage. Tremendous. It's actually going to affect genetics. It's really not good.
I've seen, because I have patients who have come to freeze their eggs, and I've had patients who were on medical marijuana for severe endometriosis pain, and I'm looking at, why is this 20-something person have such poor egg quality and poor yield? Even though you saw a lot of antral follicles in the beginning, the egg quality was not good at all. And she wants to freeze it to use later on. So I'm a little concerned about that. So please spread the word, not for your eggs.
Medical, it's it's a big no. Yes. What you're gonna do, you have an issue. So we could look and see why you're in pain, why your periods are not regular. How can we address it with acupuncture, nutrition, herbs, whatever is needed to be done? But marijuana is best used if you have cancer and you're in pain, yes. But if you're trying to become pregnant and prepare for fertility, no. Yeah. I'm not completely against it, but there are different ways of using it and when. Yeah, so you have to know when. I mean, I have a lot of couples, actually younger couples, that come to me and the husband says, I'm not going to stop. And one woman had 3 miscarriages. And basically I said to her, and this was a patient that, one of the Florida patients, because actually I work with some patients that come from Florida as well. And that doctor would say, absolutely not. Absolutely no drugs, no marijuana, nothing like that. We're trying to naturally help your body.
Yes.
Even smoking, really.
Smoking is bad for eggs and sperm. So people who smoke a lot tend to have bad quality eggs, bad quality sperm, and it makes it challenging to get them pregnant. So, excessive alcohol is not good as well. Again, it makes it challenging. Remember, quality into your body, quality out of your body. Garbage in, garbage out.
Absolutely. And so my favorite saying is, patient needs discipline to create change.
Yes.
We're used to conversations of easy. When it ain't easy, we're not doing it in this country. I come from Russia. We had a different mentality. We come from a communist country. Now, I'm not going to go into all that, but our expectation wasn't that life is so easy and you just, you do have to work hard and create change. So, and that's what I tell my patients, is that it's not going to be, one patient came to me and she's like, IVF was painful. I'm not sure I want to do that. I don't think so. And I'm like, yeah, it's gonna be. You have to understand that's part of the process. You have your husband who supports you, you have your medical staff, you have your acupuncturist, but it's not gonna be this magic, wonderful process. It will be what you're gonna make it to be. If you're
I,
disciplined, if you're praying,
yes.
if you're doing the right things, it's gonna be a marvelous process. If you're afraid, if you're not unknowing, if you don't want to change things, it's not going to be a marvelous process. So it's
And
all
this
about
that's where we come in.
yeah,
The whole ethos is this is teamwork, folks. And
absolutely.
you the patient are on that team. You're part of the team, right?
Mhm.
So we have to look at it from a team mentality where
Mhm.
you're part of the team and you're going to help us get the best body, the most healthy body possible. And we're here to support you and give information. So
And
if anyone
actually,
has, yes,
one real quick thing. I actually recently had a couple who had marital issues, and they came to me together, and they literally had those issues in front of me. And I said to them, I said, guys, I think you should see a marriage therapist before you see me, because you're trying to have a baby, but you're not in a good state. And part of the journey was that they said to me, Radha, thank you for being honest. We appreciate your work. And we decided not to come for acupuncture or IVF because we're going to go into therapy. Now, I lost patients, but my job is done because they weren't ready and didn't do it for the right reasons. And they just wanted to have a baby. I'm not here to support just whatever. I'm seeing as a practitioner that certain people are absolutely ready and certain people need
are not. Yes, yes.
counseling, for example, or they need to
And
lose.
we do work with a counselor. We encourage our
Right,
patients to take advantage, but I really emphasize and want them to get the notion of teamwork. So
absolutely.
I did promise that I'm going to make this only 30 minutes so that we don't drag it on too long.
Mhm.
I and Radha would welcome any questions. You're going
Mhm.
to get an email at the end of this. Any questions that you have, send them to me or send it directly to Radha, and I'll
Mhm.
give her contact in the
Right.
email going out. You can email her directly or email us at FAQ
Actually, don't email me, call me because my website has a
is
glitch.
glitches. Yeah.
I don't
Well,
get email.
they can forward any questions to me, and I will
Yeah.
make sure that she gets it. And those
Or
questions,
just call
yes,
me, text me,
yes,
whatever. It's fine.
yes. Thank you so
Yeah.
much. Thank you so much, Radha. This has been really
You're
great.
welcome. They didn't ask about insurance, but that's important.
Oh,
A lot of
yes,
people.
absolutely.
So I'm a
Yes,
Blue Cross Blue Shield provider.
yes.
A lot of people have coverage. Now, they're not going to cover directly for fertility, but they will cover for aches and pains. And when you're going through this process, you do have aches and pains. So that's not a problem. So, if you have Blue Cross Blue Shield, and I'm their provider, you might actually have coverage for 15 to 30 treatments. It's
Excellent. That
something
is
that
good to
people
know.
forget.
And that is something I'm going
If
to share with our patients.
Right. If they don't have Blue Cross Blue Shield, I'm still going to give them a super bill, which has my license number, which has my provider number. They could still submit to the insurance some reimbursement as now they're going to pay me directly, but they're going to get some reimbursements as out of network.
Yes.
Or
Yes.
the third scenario is that they have a flex account. And again, they will pay to the provider. I will give them a super bill and they get reimbursed for acupuncture. So that should not be a problem.
Thank you so much, Radha. I really appreciate it. Listen, thank you, folks. Thank you, ladies and gentlemen, for being here. I know this is a late evening. I really appreciate it. We will put the replay on YouTube so you can watch this all over again. I apologize, my live button didn't work.
Should we
But
talk about needles because people are afraid of needles? I just want to say
I want us to do another session and we will put
okay.
that out. And we will
Okay.
talk about meals and nutrition in that one. So I want to
No, needles.
Oh, needles. Yeah.
Yeah, can we say real quick?
Rather what I'd like to do is on a different session, we'll probably try and get a live demonstration, and we'll have a patient that you can show them.
To your center and do a live demonstration. Yeah, absolutely.
Yeah. All right. Thank you, everybody, and good night to you. And I appreciate your being here. What is this? Is acupuncture? What about CBD? We just answered that. That's a no. Please
Absolutely
don't.
not.
Not if you want good eggs. If
Yeah.
you don't want good eggs, fine. You know.
It's actually
But
going to help acupuncture as well. So no.
No. That's a no.
Yeah.
All right. And thank you again for being here. And we'll wrap this up, but we will continue because I see a lot of people are interested, and I'll gather questions so we can address them at the next one. Thank you, everybody.
We could do nutrition. We could do cooking demonstrations.
Yes.
There's so much
Okay.
to it. Absolutely.
Exactly. Thank you, and have a wonderful evening.
Wonderful night. Yep.
Yes.
Absolutely.